you having trouble getting your baby to latch onto the bottle? In this video, I'm going to show you some simple tips and tricks that will help you get a perfect latch every time. 1. What are the most common bottle feeding problems? Many parents experience difficulties with bottle feeding, particularly in the first few days and weeks. Common problems include difficulty getting a baby to latch correctly, incorrect flow rate of milk, and frequent clogging of bottles. 2. How can I make sure my baby is getting enough milk? This is a question that many parents have, especially when bottle feeding. To ensure your baby is getting enough milk, pay attention to their hunger cues and feed them every 2 to 3 hours. You can also keep an eye out for signs of fullness, such as turning away from the bottle or falling asleep during a feed. It's important to remember that all babies are different and will require different amounts of milk depending on age and growth rate. If you're still unsure if your baby is getting enough nutrition, talk with your healthcare provider for personalized advice. 3. What is a perfect latch, and how do I achieve it? A perfect latch occurs when your baby's mouth is wide open and their tongue is down, covering the lower gum line. This helps ensure that they are getting adequate nutrition from the bottle while also helping to prevent tear ingestion. To achieve a perfect latch, start by keeping your baby upright and supported during the feeding. Gently stroke the nipple around their lips until their mouth opens wide. Then quickly insert the nipple deep into their mouth so that both the top and bottom lips are secured around it. Make sure to keep an eye on your baby throughout the feed and adjust as needed to ensure proper latching position. With practice and patience, you'll soon be able to master this art of bottle feeding. 4. Are there any techniques to help my baby latch onto the bottle easier? Yes, there are a few techniques that can help make your baby's latch easier. Firstly, try to ensure that the bottle is at a comfortable angle for your baby and not too flat or too upright. If necessary, prop up the baby's head with a small pillow or rolled up hand towel in order to maintain this optimal angle. Secondly, you may want to use the nipple of your bottle as an appetizer by squeezing out a little bit of milk onto your finger and letting the baby lick it off before latching it on. This helps create anticipation and encourages them to suckle. 5. How often should I change nursing positions while bottle feeding? To ensure your baby is comfortably and securely latched while bottle feeding, the American Academy of Pediatrics recommends changing up the nursing position every few feedings. This helps to keep your baby's head in a comfortable position so they can get the most out of their feedings. Try switching between side-lying positions, cradle holds, and semi-reclined upright positions for each feeding to keep your baby engaged and attentive during mealtime. You may also want to switch which arm is holding the bottle from feeding to feeding as well. With these helpful tips, you should be able to achieve the perfect latch each time. 6. Is it normal if my baby spits out some of their food after meals? It is very normal for babies to spit out some of their food after meals. This happens because babies can't control the amount of food they eat, so sometimes they may take in more than they are able to handle or swallow. It's important that you don't force your baby to eat if they appear full or uncomfortable. Instead, take a break and offer them smaller frequent feedings during the day so that they can get used to eating gradually over time. Spitting out small amounts of food is just part of learning how much and what type of food works best for them. 7. When should I contact a doctor about my child's bottle feeding struggles? If you're concerned about your baby's bottle feeding struggles, it's best to contact a doctor. A doctor can evaluate your baby and determine if there are any medical issues that could be contributing to the struggle. They may also have advice and tips on how to help your little one learn to latch correctly or transition from formula to breast milk more smoothly. With their help, you'll be able to ensure that your child is well nourished and developing healthily. Bottle feeding can take some time and practice, but with patience and persistence, you'll soon find success. We hope you found these bottle feeding tips helpful. Achieving the perfect baby latch is a crucial step in successful and safe bottle feeding. With practice, patience, and guidance from your healthcare provider, it can be done. If you have any other questions or concerns about your baby's feeding needs, don't hesitate to reach out for help. Be sure to comment below with any additional tips that work for you, or subscribe so you never miss another video like this one.